Obesity in children. What is childhood obesity? Symptoms, causes and risk factors, multiples, diagnosis, treatment, protection. During the last 30 years, the number of obesity cases in children and adults in the world has reached the epidemic level. A quarter of adults today are obese, and it is estimated that this percentage will reach half of adolescents within the next decade. Obesity is defined as an increase in adipose tissue in the body relative to age and gender. The mass of fat is determined by the level of balance between calorie consumption and burning, which is regulated by a network of hormones and nerves. Any disturbance in one of the components of this process can cause energy storage and weight gain. Weight loss benefits. Several studies have shown that being underweight reduces risk factors, such as reduction of blood pressure, low blood sugar level, improving the level of fats in the blood. Individuals who have an increased risk of obesity and its complications must be identified, and their obesity must be treated until they reach and maintain the required weight, and this is accompanied by maintaining appropriate nutrition that enables continued growth and proper maturation. Secondary obesity in adults. Secondary obesity is rare in adults and is caused by an imbalance in the activity of hormones, such as hypothyroidism, excessive secretion of cortisol, and damage to the satiety center in the hypothalamus, or caused by genetic syndromes. Secondary obesity is characterized by disturbances in physical and sexual maturation, and the emergence of distinct evidence on physical examination, and the appearance of early obesity is considered a serious cause of high morbidity and death. Adult obesity is associated with a doubling of the risk of heart disease in young adulthood, such as high blood pressure, an increase in the proportion of fats in the blood, insulin resistance, and the emergence of type 2 diabetes. Symptoms of obesity in children. The main symptom observed in childhood obesity is that the child has a high weight and a large size compared to his peers. Causes and risk factors for childhood obesity. Most cases of childhood obesity result from primary obesity, which is the result of genetic and environmental influences. 1. The causes of childhood obesity. The following are the main causes of obesity in children. Genetic factor. The genetic factor greatly affects the amount of fat in the body, the way of eating, and burning calories. In addition, a defect in genes that causes obesity has been identified, such as defects in the leptin gene, the leptin receptor, and the melanocortin receptor. Environmental factor. On the other hand, the rapid increase in obesity cases indicates the importance of the influence of environmental factors. In the past, the advantage of storing fats was of great importance in the struggle for survival in periods of famine, but in the Western world, which is enriched with an abundance of food, and in which physical activity has decreased significantly as a result of the increase in the number of television viewing and the use of the computer, the storage of fats has turned into a negative issue. 2. Risk factors. The most important factors that increase the risk of obesity are lack of exercise, the unhealthy nature of children's eating, medical family history, family tension, economic problems, taking some medications that increase weight. Complications of obesity in children. There are diseases that appear in people with obesity, including shortness of breath during sleep, sleep apnea, increased fatigue, and a decrease in the level of academic achievement. A tendency to increase intracranial pressure, characterized by headache and blurred vision. Psychological and social problems as boys refuse to accompany the obese, and therefore the obese child tends to be depressed. Diagnosis of obesity in children. The disease is diagnosed by the following procedures. 1. Body mass index, BMI, measurement to estimate obesity. A body mass index, BMI, can be used, which is calculated based on body weight in kilograms divided by the square of height in meters, compared to a typical graph. Overweight is defined when the body mass index is in a range that exceeds the 85% percentile, while the definition of obesity is when the body mass index exceeds the 95% percentile, in proportion to age and gender. 2. Blood tests. Among the most important tests conducted to detect obesity and its risks: cholesterol check, blood sugar check. Treating obesity in children. The foundations of obesity treatment depend on the following. 1. Treatment of obesity with nutrition, through balanced meals while reducing the consumption of fats, especially animal fats, and refraining from saturated calories. 2. Behavioral obesity treatment. Develop abilities to maintain a healthy weight over time, control cravings, and educate to acquire correct eating habits. 3. Physical activity. By raising the level of energy production, increasing the hours of physical activity, and reducing the hours of watching television and electronic games. 4. Drug treatment of obesity. So far, the use of drugs to treat childhood obesity has not been approved, and much research is being conducted to examine the efficacy and safety of these drugs in young children. Only a portion of adults respond to the drugs available today, and most of these drugs have side effects, and if the drug is discontinued, obesity generally recurs. Surgery is not recommended for boys except in cases that are life-threatening in the short term due to obesity. In recent years, there has been a development in understanding the mechanism of obesity, but this understanding so far has not been effective in curbing and treating obesity, since the complications resulting from obesity appear at a young age. Obesity must be dealt with as a chronic disease that requires follow-up. In this period, the most effective obesity treatment is in attempt preventing obesity. Prevention of obesity in children. Obesity in children can be prevented by follow a healthy diet, playing sports, sleep enough,